Well, welcome to another podcast today from Odell Technology. Today, we're very fortunate to be talking to Paul Weston. Hello, Paul.
Good morning, Stephen. Great to be with you.
Good to see you again, Paul. Paul, I was wondering if you wouldn't mind telling the audience about your background and how you ended up where you are today, please.
Of course, with pleasure. I'm super excited to share my background with everybody. So I started off in digital health coming up to 5 years ago now. Preceding that, I worked for 15 years as a buildings architect. I developed and founded an architectural practice, but my specialism was in healthcare buildings, so moving services from secondary care into the community and working with those clinicians, those patients, and those commissioners in order to make sure that the services and the buildings we provided were suitable to do that. Fast forward to the end of those 15 years and looking at the next part of my career, I came to the conclusion that really the answer wasn't building new buildings, it was keeping people out of buildings to start with. And that's where really my journey into digital health started. And I had the opportunity to exit from that company. I organized a merger and acquisition of my practice. And then starting out in digital health, I undertook upskilling and training, picking up from where I left off with computer science and new agile project management areas. And that's where I met, through Hack Days, Dr. Greg Birch and Matt Bourne from Tiny Medical Apps, where I helped them in their product development role and also in their assurance and developing the assurance side of things, as well as getting them onto major NHS and UK government frameworks to develop the Digital Health Passport, which is a product for children and young people with asthma and allergies. And through that experience, I became aware of Orca. We got our Orca score for the Digital Health Passport from 66% to 88%, still the highest, I'm pleased to say, with asthma self-management. And I became aware of a role at Orca, which was in terms of leading the review and accreditations team to develop new assessment products, both here in the UK to respond to things like the NHS digital technology assessment criteria, but also internationally as well. So working in the USA, in Canada, Australia, and most importantly as well, which is where I am now, is thinking about those larger set pieces. So I was very much involved with a project called Label to Enable, which is a EU-funded project to operationalize ISO 82304 Part 2, which is an assessment criteria for digital health and well-being apps and other products as well. And earlier this summer, I realized that I wanted to jump back into really having a exciting and visceral contact with outcomes and to help innovators to align that commercial, their product and their assurance roadmaps to really deliver on the promises of digital health. And that's where I am today, having founded my consultancy at Power.
Fantastic. Thank you for that. Now, tell me, you're a consultant for BSI as well, British Standards Industry. Would you mind telling me something about that?
Yeah, of course. So I've been invited to join the IST 35 committee, which is around health informatics. Through my work with the Label to Enable and ISO 82304 Part 2 project, one of the leaders of Work Package 2, Charlie McCabe, invited me to be a part of that, especially as I was exiting the more formal world of accreditation development with Orca. He felt it was really important that I still contributed to that ongoing assurance and development of standards. And so it's a great privilege to be accepted as part of that committee. And so we've got some committee meetings in a couple of weeks' time, so I can really start to help to drive from a perspective of the development community. And for me, assurance and regulation is about three things. It's about being objective, it's about being consistent, it's about being scalable, and most importantly, I think from everyone's point of view, it's about being proportionate. And so these are some of the themes I'm hoping to bring to that committee position there.
All right. Now let's talk about your consulting firm and what you're up to with consulting across. I think you're doing it across Europe, aren't you?
That's right. So I'm with with my consulting firm Power, which means be opened, it's based upon a interpretation of the Greek letters for the word ephefa, meaning be opened. For me, it's around how do we look at the global demand for digital health tools, but also what are the assurance layers underneath that. So, for example, Research to Guidance published a very good report earlier this year, which showed the top 4 areas for digital health innovation are the US, Germany, the UK, and then France in reverse order of magnitude. Obviously, each of those jurisdictions has developed different ways in which we not only look at the regulatory and compliance aspect of technologies, but also the so what, so that effectiveness piece and other localized issues. And so what I'm trying to do within my consultancy is to make sure that we embed those core concepts which go right across different global frameworks into our everyday work, different project teams, but also making sure that we've got that built into our product roadmaps in order to deliver first value, both for primarily our users, but also making sure that we've locked in that value for our investors and also for others as well as soon as possible, so we can show incremental improvement over time whilst maintaining an assurance backbone.
Do you deal with the payers at all? Do you discuss the value proposition with payers?
My approach is to try and to understand what are the payers' requirements and what they will be looking for in terms of making those decisions. There's right at the very beginning of thinking about, and at every stage within a digital health product life cycle, that's what I call the vital. How vital is this product? That's where we can think about value proposition. We can think about surrounding evidence or other market intelligence and other published research papers that can back up that value proposition day one to start to tell that story. As we then develop through the different development cycles, so making sure your product is usable, so meets user need, making sure it is secure both in terms of data and technical assurance, making sure it is safe, so actually meets the regulatory side of things, as well as thinking about risk as most importantly. But then the next part is that effectiveness. Is it effective? And this is split into 2 parts in terms of payers. One is clinical effectiveness. So can we demonstrate to those clinical users and those clinical decision makers that the product is, what is the clinical effectiveness, and to make sure it does do what it says on the tin. Very, very important, back to that value proposition. Can you justify and back it up? But the next part is the so what, is that benefits part. Now that might be in some contexts and most contexts around economic evidence. So demonstrating to so if we're looking in the UK, we're looking at the NICE ESF and early value assessments. In the US, the amazing new work of the Peterson Institute, looking at both of those aspects. And then in the EU, we're looking at the DIGA in Germany and the PECAN scheme in France as well. All of them share these. Now they'll all have different quirks and nuances potentially, but at the heart of it, we've got to think about how you demonstrate both of those.
Interoperability, is that something you help with?
Indeed, it was my route into digital health. I attended hack days when I started off in the industry with Interopen, and that's how I got to know the guys at Tiny Medical Apps. And so we worked on a project there which was thinking about how we can scale and make interoperability easier for everyone to understand. So super interesting there. Now, what I will say, the conclusion that I've come to at the moment is read the documents, number one, but most importantly before that is to understand and think about why you want to and how you're going to interoperate with clinical systems. It's still a really difficult question, and ultimately we need to focus in on each and every product who wants to use data from healthcare contexts, why you need to collect it, how you need to collect it, and then most importantly, how is that going to be then replayed back into the system, back into the health record? But then who's going to look at it, where, when, how, why? So I think, we've still got quite a long way to go in terms of actually actioning on that data, but it really comes down to the why and thinking about those user journeys and those data flows, because the rest of it will come with time. But you really need to fight a battle at each and every stage. And I think it's important to point out as well is that interoperability is so context specific. You will end up fighting those battles each and every time you get a new contract as well.
AI is everyone's mind these days, and I think that's something you've been heavily involved with in the past. Would you like to talk about your experience with AI?
Yeah, no, of course. At the very high level, I think we shouldn't treat or think about AI necessarily any differently from than other technologies. I mean, if we look at complex clinical calculators, for example, potentially a form of decision trees and decision making, the concepts are still the same. So fundamentally, clinical safety, risk assessment, understand and communicating those risks and those benefits back to clinicians. I think it's super important. What we found at Orca was people starting to throw generative AI into their products, strongly resist that. It needs to be built in right through your product development process and your assurance process, because it's not a case of not a case of it being light touch at all, or potentially useful. Can be incredibly potentially harmful, but you need to make a proper balanced assessment based upon that context specific areas. Now, saying that, there are some really big issues there. As we know, AI should develop, should learn, should improve. And so I think one of the big areas, and we're seeing this right across the EU, but also here in the UK, developing regulations as well. There's a new British standard 30440 that I'm getting involved with as well, and that's really sort of thinking about how we can align it with existing things like medical device regulation, which is fairly static, but we need to make sure that regulation keeps up with in terms of it being more agile, but also ensuring safety as well.
Interesting you talk about medical devices. So obviously hospital at the home is a big thing these days, and keeping people at home.
Yeah.
There's a number of digital apps that claim to do that. I think that for the audience that we have, they're very interested, I know, in physiological monitoring and the use of apps and communication with medical and nursing professionals. You've obviously had a bit to do with that.
Yeah.
Could you describe that for me?
Absolutely. No, absolutely. No, one of the when we're starting to look at, once again, looking at that patient journey and where care is best delivered. And one of the, certainly here in the UK, but this is true right across Europe and the world, a hospital environment is it has to be used with great care, because it's a finite resource and incredibly expensive resource as well. And so thinking about how we can safely discharge people back into the community, back into their own homes, both in terms of post-operative, very important, but also in terms of where they've had an emergency admission and then being able to be safely discharged into their own homes as they recover from that exacerbation. And part of that is understanding, obviously, what it is, once again, the question, what it is that needs to be monitored and why and for what purpose. And the technological aspects around that and how we do that have been demonstrated in multiple different products in multiple different areas. Now, I think what we need to do is to get more specialized in terms of the wraparound to this technology as well, and seeing these products more as holistic services. We're seeing that in the US quite a bit, whereby telemedicine is, it is not flying from providers, but providers who use telemedicine as part of their offer, and the offer is that technology with a service. I think that's where there's a great potential and a great need, because we need to start to reduce the impact we're having, to reduce the impact on those secondary healthcare services by actually providing those services and not just being an adjunct, and indeed adding to the workload. For example, data flowing back into hospital context. We need to train those people. We need to create those new pathways. We need to create those virtual ward communication centers, which is perfectly doable, but people need help with that, and we need to make sure we've joined that up.
So Paul, if an SME is looking to expand or enter into the European Union with a digital solution, how would they best go about it?
I think there's a number of things that they can do. I think the work that I've been doing with Label to Enable and the new ISO 82304 Part 2 standard is a great place to start, to get an overview of your product. As I was alluding to earlier, there's several pillars and beacons that I use when I'm talking to all sizes of and stage companies, which are looking at whether it's vital. So examining that value proposition and what people have got already, thinking about usability and where they stand within those areas, looking at security. So thinking about both data security, and within this context, obviously GDPR is a very important within the EU context and has to be a very high priority, but also thinking about that technical security as well, and how different jurisdictions and where data is being stored and how that data is being secured is really important. Then thinking about the safety aspects. Now, in the US, there's different aspects. If you get it wrong, you get sued. However, within the EU context, and certainly within the UK, taking a more proactive area in terms of investing in risk assessment and having those skills in house, and then following on from that, areas around that effectiveness part. So looking at what evidence you've got, can that be applied to the EU markets in terms of the evidence you've already generated, or how might you go about generating those evidence? So particularly within the UK context, getting those case studies and those startup and those starting projects within the NHS, which is a great place to start in terms of having engaged clinicians who really want to explore the use of technology within their clinical practice. And so what I've typically done with companies is to look at that overview, to review what documentation they've got already and what assurances they've got, and then to make both recommendations from an advisory point of view, but also to help them make introductions as well to others who can actually help them write their homework, but also help make those introductions as well, more broadly as well. Yeah.
So Paul, could I ask you about your background in regards to developing assurance systems for digital health? How do you go about that? And I know you did a lot of this work at Orca.
Absolutely. No, thanks, Stephen. It was a phenomenal time that I spent at Orca, and I think one of the, an absolute testament to Liz Ashall-Payne and Tim Andrews, the co-founders of Orca, for driving the prevalence of assurance frameworks really to the fore, and in certain ways the main thing being able to get an output from that. So the Orca baseline review score, I think, is still incredibly valuable, and as part of that work we launched the digital health assessment framework in the USA that my team helped spearhead. And one of the big areas there, I think what we're finding is, as we went through the development of these different assessment frameworks, that we have really coalesced around some of those big topic areas that I mentioned previously. And so, I think really that scalability of different frameworks and that international view and perspective, I feel is actually converging mercifully rather than diverging. And we've done this in a number of ways. One is really listening to user feedback, and it's got to be, as we're developing different frameworks and ways of demonstrating assurance, is by listening to both the industry, both to the end user, to the payers and providers. And I think this has been drawn out in terms of the development process by that engagement, whether it's a Delphi study concentrating on particular subject matter experts right across the field within a particular jurisdiction, or whether it's using other design and user feedback ways of working, but really thinking and putting, and this is what we did at Orca quite closely, is putting that user research, that product mindset behind developing frameworks, because ultimately there has to be, back to the sort of vital, is this a vital thing to do? There has to be a constituency who wants to use the outputs of that assurance framework for a particular reason. And is it explainable? Does it have value? So a great looking right across the board, the work for label to enable and the ISO 82304 Part 2 scheme is you have an equivalent of an energy label for a digital health product. So really understandable from an end user, from a clinician's point of view, that it is safe, effective, secure, usable in one glance. And so I think to me, thinking about regulation and assurance as those valuable outputs is absolutely essential.
That was excellent. Thank you very much for that. Well, it's been an absolute pleasure to meet you and see you again. And I thank you very much for your time. I look forward to talking to you in a few months, and you could give us we could discuss some user cases that you're involved in. So thank you very much for your time today.
Thank you so much, Stephen. It's been a pleasure to join you as well.